Dr. Matiko Giabe, the County Director of Medical Services, Kisii. Today we are meeting here with the NCD group, which constitutes of the ambassadors from various parts of this county, to look at the various challenges that they are facing and how we can address them moving forward. In Kisii County, we have a very robust program for NCDs with an appointed NCD coordinator in the county who ensures that all activities in as far as screening, early detection of the various NCDs done on good time and appropriate referrals made so that we can avoid the complications that are attendant to these diseases if not captured early. The patients that we have in our wards, around 40 to 50% constitute those who have NCDs, with a majority tending to be those related to cardiovascular disease. And this doesn't vary so much from the national figure, that is 40%.
Which were invited non-communicable disease, the ambassadors. We have listened to their views, their demands, what they need, and we have resolved that we'll work together with the executive and the KTRH the health department to make sure that they come up with policies which can favor them so that we can pass them in the assembly, because that is our role. And even we talked about the budget. We will talk with the executive to make sure they increase the budget, because our part is not making the budget but passing the budget. So once we will talk with the governor and to make sure at least more funds are put in the health committee, meaning the health department, so that we can cater for these problems. And one thing we came up with, we see that these diseases are very dangerous and they are killing our people, and therefore we are asking our people that there are things that we can do before we go to the curative part of it. We can do the preventive, and part of the preventive, our people needs to do a lot of exercise and make sure they don't depend on carbohydrates only, carbohydrate foods. We need them to balance, to have a balanced diet and do a regular exercise. That way we shall have prevented these conditions. I also applaud our CHBs, because what I need to do is we need to make sure they are informed when they go out there. They know exactly what they are assessing and what they are to advise the patients to do. And for those little remarks, we appreciate you, and we will work together and make sure these things are realized in our country.
With the efforts that we've so far made, we still have challenges that need to be addressed and that have been raised in this forum by the various ambassadors. One of them being commodity supplies. And as far as this one is concerned, the county, through the leadership of His Excellency Governor Simba Arati, has been responsive. In the recent past, we've seen different batches of medicines being dispatched to counties. The latest being medicines worth 50 million shillings that were sent to various sub-counties. And this will go a long way to support the other activities that are done by the healthcare workers. In as far as the technology is concerned, to ensure that we have end-to-end management of these patients, the county is in advanced stages of rolling out HMIS system that will ensure that a patient seen, say for instance in Kenyanya, the information is portable to KTRH, which is our main hospital, and they can easily be tracked and managed without having any loopholes.
Kwa so ombati wato uroira kwa sukari ono gaiga usi yondo manyakiroko utenerere tabantu baria babwata marwaire atari kwambukira marwaire atari kwambukira muri sukari kansa chindurume na marwaire ali amanga atari kwambukira ituko lya rero igo twara abarai baito bagusiga iga kurunya gitari na kurwa ase county bagambira mangana maya na ina bonta gete goteba nga kenya saba sisini gekogera ono gaiga barwaire ba minto na poto gutwara wasemeri nga kuruga ibintongo chikoba bire buya tutagete kwakera umweshimiwa arati ngambia mono alia general yeito kwenye ndugwato mwachando musini ni mnabona chinyompa chiri choko yanda wachano twagakaniri chisiringi 10 lakini rero yokugenda obosa ebintu binde ebirogo byarengari twari gwikaransira magena rero taiyo etwikaranse ebirogo ebija kabisa yo mweshimi kana botete gwakira mbia mono ase emirogo yeyo ekitware kubasaba igo twari gotaka tumanyekane muna abarwaire barwata amarwaire munaya muna bone especially yo bantu besukari etakiro nyore egento getobegete gosenko bako gosobegete kadi umubuko ekero gwetense abantu bago gotama nga kero kende ndurumo kwetu ekara nyorire gente kyo mubuko ngaye n'umuntu gwesukari nabo abantu bagosomirwa sibarasa umuntu gwete kabireye litangani kara cheki umubuko nkikero bakanyora ngane kadi rero tabangana umuntu gwesukari yale ne sukari na ade kuriywa omenyo umuntu yoba ibagari gotamu aku igo naende boraibwa abaire nyagitari ano buya na bora gwese ngenjo abanyagitari barusiwe gusonga iga batomire ki nyagitari na bono marani eri bakoroka level 4 keumbu manyango chikenyenya ibago monta kurwari kenyenya chega iga ngane clinic yago cha bona bagukorera kenyenya zakorera marani iga bantu baito to kubatebinga onya ritukuria uri clinic ya ikire korange na kenyenya yenda kenyenya okorerwo ibagario kumenya ko cha bosongo gaiga ekora enamba ne nyingi to gocha twabari egende twatebire ekero to ko bari nyagitari turabange yo to konyara to gosumbuka sana bona twale kuborie twababori nga bagende babeka abanyagitari babange batokora kurwa bwango ibago muntu okobanyagitari wanyora nandi gubwata umuchano ikisukari cyasareka usumo bire cyasareka twarwa bwango twagenda ekende naende twababori nga amaryogo mbago ganya pakaera twamanya gujigo okoraki twamanya gujigo je twanyora nga maryoga ayitaiyo waise kubeko moroberio gogo twaya maryoga ayo ekero toya tagete aya pressure aya sukari na ali andonsi yora nyole to komenya ubugimo buya.
It is in as far as specialists are concerned. We rolled out last year a program that ensures we have roving specialists. So all our 9 sub-county hospitals have days when specialists visit and give specialist services for diseases that are related to NCDs. And we intend to roll out the other batch that entails surgical procedures and clinics in the next few days. And again, we believe this will cut down on the complications that arise from late detection and management. The other aspect through which we want to combat NCDs in the county is through our people enrolling in the SHA and SHIF, so that now that all patients will be managed on a referral system from level 1, level 2, level 3, and subsequently into our main facility at KTRH, it's important that all our populace registers in SHIF to get services at the very points of service delivery where they live, and appropriate referrals are made to ensure that they don't miss the opportunities for management at any stage. What we've ensured we are doing as a Department of Health is to work together with the County Assembly, and today here we have the leadership of the Health Committee which has joined us so that they can hear the various problems that our ambassadors representing the various NCD